in this program, it's just such a great breakdown between teaching and education. I mean, we've got weekly meetings and we've got lectures to residents, for example, so the actual MD radiology residents can brush up on their physics. And then we've got independent or collaborative research, which is another big part. And then, like I mentioned, the clinical stuff, which is probably my favorite so far, which is just getting out there and learning about these different instruments and seeing what's going on.
4 to 5 years ago, the Department of Radiology and Imaging Sciences approached us in urology and said, hey, there's a new imaging tracer that almost nobody in the world has. It had been described out of Germany and a few other places, but they said it's called PSMA, and it's an enzyme, it's a receptor that seems fairly specific to prostate cancer cells, and we have the expertise to image this. This was pretty exciting at the outset, but got more and more exciting as we got to meet some of the research scientists. So Dr. Gary Hutchins, Dr. Mark Green, we got to meet some of those on the clinical side doing the research. Dr. James Fletcher, Timel Turkis, and Dr. Mark Tan and Jordan Swenson, among others. And so this collaboration started and with a lot of excitement. And after a pilot study, we realized that this PSMA helps us to see things we could never see before.
The patient population is actually pretty diverse, right? Like because this is kind of the place that people go in Indiana for their healthcare needs. If there's a specialized condition, that sort of stuff, where you're able to see a lot of that diversity, that makes it really unique as well, I think.
I am mainly a pediatric neuroradiologist, and my interest is in fetal and neonatal neuroimaging. From a clinical standpoint, I try to optimize our MR images. As you know, the neonatal brain is different compared to the adult brain. It's not myelinated, it's much smaller. We also image our neonates mainly without sedation and during natural sleep using something called the feed and swaddle technique. So it's really important to have obtain images that are quick, but with higher resolution, as well as with good contrast and signal to noise. So we cannot just use the routine adult parameters for our infant images. We just optimized our infant neuroimaging protocol, and I'm thankful to say, with help of our MR physicists, we were able to do a good job. We also recently brought the functional MRI in children to the Riley Hospital. Previously, children who needed functional MRI for pre-operative planning to identify the motor cortex and language regions of the brain, they actually had to travel to the adult hospital to get that done. But after quite a bit of collaborative work with our physicists and myself and the MR vendor, we were able to finally bring it to Riley, and our children no longer need to have to travel outside the hospital to get this service.
So we have this dual energy head protocol that we're doing. So on stroke patients, after we've scanned them, not the first scan, but the follow-up after stroke, physicians want to make sure the patient isn't bleeding. They want to know in their brain, in the head CT, is it blood or is it contrast, like contrast blush? So with the scan, with the spectral scanner, what we can do is do a typical head CT here, but we have the spectral recons. Just because I know virtual non-con here, we're going to virtually remove contrast from the brain. That way, when you do that, if you still saw blush or white, then you would know that was blood versus contrast. And you also have the iodine no water, which will basically do the opposite for you. That way you can differentiate.
I applied to like 10 different programs and didn't know too much about IU until I came here and visited and got to meet all the faculty and tour the facilities, and I was just blown away by how, like, A, how personable everybody was and friendly and helpful, and B, like how impressive their hospital system is, and then the cool technologies that they have, and being sort of on the cutting edge, and then sort of a large scale operation. And so I came and visited here, and I was like not expecting what I saw, but was really impressed and knew that I wanted to come here. Indy I like because there's you don't have as much of that bustle, but there's still everything you would want. You know, there's cool things to see and good restaurants. And
to be able to have experts on this team from the Department of Radiology and Imaging Sciences is just really makes it fun, because they bring a wealth of knowledge and understanding. I mean, decades of research experience, of grantsmanship. So one of the highlights of my career so far has been this collaboration, and I look forward to a lot of discoveries, and most importantly, bringing patients hope and healing through this collaborative effort.